additional basic tips are, having a well-balanced diet, staying hydrated to keep those secretions thin so you can cough them out with assistance. Good breathing exercises, deep breathing exercises, and repositioning throughout the day helps move the secretions a little bit better too. Persons that are in wheelchairs are a little bit lower than standing people. And we know the coronavirus is a droplet virus, and droplets drop. So they're at more risk of getting the droplets not only on their hands, but on their face. So social distancing is important, but not just washing your hands, washing your face. Also be aware of the frequently touched items on your wheelchair, such as your brakes, your joystick, your push rims, armrests. All of these items need to be wiped down throughout the day. Caregivers have to be very astute to, number one, being aware of the significant risk and illness that can occur to this population if they got COVID. So things they could consider to do would be take their temperature in the morning, make sure they don't have a temperature over 100 degrees, 0.4, wear a mask into the person's home, make sure they're washing their hands before they touch the person they're caring for, and do not touch that person's face. They really need to be vigilant about not touching their face and the person's face that they're caring for. And if they are around people that have the coronavirus, they need to consider not to come to that person's house, which then in turn puts a person with a disability in another conundrum. Sometimes they need to have a backup plan. They have to have backup caregivers ready on time. For example, if they're up in their wheelchair during the day and their usual caregiver's sick, somebody else has to come in and help them get transferred back to bed. Other things they can think about is making sure their medications can get delivered to their home as a backup plan. Groceries can be delivered to the home. If they have an assisted pet animal, someone has to help manage that as well. So just really planning ahead, what if your caregiver gets sick? Persons with disabilities really need to take extra tips and precautions just to avoid this coronavirus. They have the weakened muscles in their chest and abdomen, does not give them a good cough. They can become much sicker and more severely. So by taking additional tips and being really aware, not only of the patient or the person with the disability, but their caregivers and those around them.